Greetings, my fellow YouTube nurses. I know it's been a minute, but I want to talk about the most important question I got from my subscriber. Thanks for subscribing, by the way, guys. He asked me, as a nurse and professional, how do you deal with death? It's inevitable, it's going to happen, so you have to deal with it as a professional, and what are you going to do when it occurs? Okay, so basically, to give you a quick update, I've been solo in the CVICU for the last 2 weeks. It's been crazy, hectic, chaotic, and it's been a fiasco, but exciting at the same time. Just recently, I actually dealt with death, and I've dealt with it before at a SNF, which is care home center. I've dealt with it at a med surgical floor, but actually dealing with it in the CVICU or ICU is a lot different because you have to follow protocol after that happens. So anyway, this patient, just before I went into work, basically code blue, and at that point, he went in VAFib, they shocked him, we gave him 3 amps of epi, gave him some fluids, bolused them, came back, hypotensive. At that point, we gave him more bolus of fluid, and we gave him 2 albumin. At that point, blood pressure was barely elevated. We put him on pressors. So I'm dealing with all this when I get on the clock. So I'm just rushing, getting all over the place. Completely different from how, the med surgers. And all of a sudden, I'm taking care of him. So I go home the next day, I come back. I'm like, oh, great, another hectic day. Well, yeah, the patient became DNR. They put him on comfort measures. And this is where it hit me like a ton of bricks. I'm like, great, this patient's going to go on my shift. So right when I clocked in, they extubated him, and we put this patient on comfort measures on a morphine drip. So the family's there talking to him, holding his hand. Patient's pallor at that point, cyanotic, his little fingertips started turning blue. His respiration started decreasing from 1810 to 4 to basically 2 a minute. And he was strong soldier. He kept going. He was sinus tachy, then he went to normal sinus by 80 to 60 beats per minute. So about an hour and a half later, all of a sudden the patient family left. And it's weird how fast, amazing the patient can just drop on the vital signs when the family members leave. So once they left, they went outside for a minute, and at that point the blood pressure started dropping and the heart rate went down to 30 to 20. I mean, it was sinus Brady, and it went down to 10 beats per minute. And that's when I knew, great, it's going to happen right in front of me. And the respiration decreased from 6 to 4 to 2 to 1 a minute. And at that point, right when the family left, 2 minutes later, patient stopped and it went asystole. The heart rate completely stopped. And I looked at the patient, checked, there's no blood pressure, no pulse, no heart rate, there's no respirations. And so at that point I knew patient had passed. So at that point I was feeling very, very like the sense of ambivalence. I didn't know how to act, but as a professional I had to call the family. They came up, called the doctor, and the family took it very well, but for me, for some weird reason, I didn't handle it as well as I thought I would. I kind of had to leave the room for a little bit just to kind of milk it in and understand, yo, this happens all the time in the CVICU position, and I have to, take this by stride. So what we did is call the doctor. He pronounced death at the time, and then, we follow protocol. Different hospitals have different protocols, so you have to call the donor hotline, see if the patient can have, if they can donate their organs, if they're okay or a good candidate. Then you call the coroner's office, see if make sure that it wasn't a false play kind of death. And then if it's okay by them, you can discontinue the central lines, PICC lines, any type of line fully. And at that point, you call the funeral home and you get them ready, all set up. Clean them up, take the tubes, the lines out, and you put them in a body bag. So at that point, that's when it kind of hit me, because the body, you have to get it within a certain amount of time before the body goes into rigor mortis. You guys know what that is. So basically, it all hit me when I was doing this. I just kind of felt a little lightheaded. I'm like, wow, this is going to happen a lot on our ICU units. So I dealt with it differently, but it's going to happen to anybody, all the professional nurses out there. You have to learn how to deal with it. So I spoke with the family, showed a little sympathy, empathy, and did a little prayer with them. Now, not a lot of nurses do that, but that was just me. I felt like it was just my time to just kind of talk to them. And so it was hard, but I don't mean to put this on a damper for you guys, especially in the holidays and Christmas and New Year's coming around the corner, but it's inevitable, it's going to happen. You guys, I wanted to, explain this to you guys because I had an important question from my fellow YouTube subscriber asking how to deal with death as a nurse. So that's what happened, and basically, guys, you learn, you become stronger from that. But of course, what's our goal as a nurse? To recover these patients, make them better, and save them, correct? Well, this patient had comfort measures and he was a DNR, so it was a different situation. But anyways, I wanted to explain that to you guys, my fellow YouTube nurses. If you have any questions, don't forget, drop it down here, put it on my page, follow me on Twitter and all that good stuff. Leave questions. I'm going to try to crank out new videos and keep you updated in the CVICU position. So my fellow YouTube nurses, don't forget to subscribe, hit that like button, and share the video. Happy holidays, Merry Christmas, and Happy New Year's.